Hi, friends. Happy Thursday. I wanted to come on live because what I have seen from my last two posts about the novel coronavirus is that many of you have appreciated my thoughts on the situation, and it has answered some questions for you, and many of you have shared the information that I have presented. And so I thought that I would give you guys a little bit more insight through a live video, at least in terms of where I am coming from. And I will tell you that most of you know I'm a doctor. My dad is an infectious disease specialist, and I have been reading a lot about this, but the information that we have about this virus is changing literally minute to minute, and the numbers are changing, and I think our perceptions of what is happening is changing. And I will be the first to tell you that I naively thought 2 weeks ago that this was just a glorified flu virus that the media is going to town with and is unnecessarily instituting fear in people who don't have access to proper medical literature. And I will tell you that in this last week, and especially in these last 2 days, I am definitely changing the tune of what I feel and what I think about this virus. To give you an idea about what is happening, the flu that we get every single year, you guys all know about influenza. The average mortality rate for the flu is 0.1%. The previous flu season that we had from 2018 to 2019 was a bad one. And we had somewhere between 60 and 80,000 deaths in the United States from that flu season, which is a high number. The mortality rate for COVID-19 right now is somewhere between 2 to 3.5%, and that is coming out of studies in China and Italy. And many people will say, well, the people in China were in the slums, they didn't have access to quality medical health care, and the people in Italy tend to be a lot older, and so they have a lot of other comorbidities, and that's why their mortality rates are much higher than what we are going to experience here in the United States. And you are correct that we do have a lot of quality medical care here in the US, and perhaps we don't have the exact percentage of elderly folk that Italy has. But we also have a lot more people in general, and we are also very good at initiating panic and pandemonium. And so going back to those numbers, right now, the estimated mortality rate for COVID-19 in the United States is about 1%. So certainly better than the 2 to 3.5% that we've seen in China and Italy, but 1% is still a strikingly high number. And if you extrapolate that bad flu season that we had from 2018 to 2019, where 80,000 people died with an average of a 0.1% mortality rate, that equals 800,000 people in the United States in these next few weeks and months. That means that every single one of us will know someone who will die from coronavirus. But we are in a very unique situation, guys. We have seen what's happened in Italy, and we have seen what's happened in China. And if you talk to those in Italy, they will tell you, we were just like you 2 weeks ago. We thought that the idea of a military enforced quarantine was something that you read about in history books, and it would never come to us. And yet here we are. So we have this opportunity right now to engage in social distancing, and it's really important. It's not all hype. The fear is real, and if we do this on our own, life can continue on as normal, just at a slower pace. What it means is that we stay home more than usual. We don't go out into big crowds. Yes, school might get canceled and large events might get canceled. And as you've already seen, almost every single one of the public universities in California have closed their campuses because you simply cannot have 20 to 40,000 people in a close proximity and expect that this virus will not spread. The virus itself has an incubation period of 2 to 9 days. And the average time that it takes for someone to develop even mild respiratory symptoms is 5 days. So that means that if you or I contracted this virus for 5 days, we would walk around and we would go to work and we would interact with probably hundreds of people in a matter of 5 days. And we would touch all sorts of inanimate objects through our grocery stores and our cars and our classrooms and our offices and our workspaces. And we will have never known until we start to have symptoms that we even had the virus for 5 days. And this is what's going to be true of our kids, because fortunately, very, very fortunately, this virus does not seem to have a strong predilection for making children ill. But I will guarantee you that our kids are going to be the vectors because they are going to feel fine. They are going to have this virus. They are going to shed this virus, and they're going to be out playing and doing the normal things that kids do. And then they're going to go visit your parents or their grandparents, or our grandparents, if you're lucky enough to still have them in your life. And that's when it's going to start getting very, very real. And this is why social distancing is important right now. I know that people are saying, well, let's just wait until we have our first case here in Kern County, where I live. But that defeats the purpose. It's already here. I can guarantee you there's somebody who has it, but they don't have the symptoms of it, because a lot of us are not going to manifest very severe symptoms, but yet we're going to have the ability to spread it. And so if we can be proactive and we can start social distancing right now, we actually have a fighting chance not to go through what China and Italy are going through. And this is so different than anything I have ever lived through, and I assume most of what you guys have ever lived through, but we have a chance to fight it. And when, sorry, I lost track of what I was saying. When someone in your life, whether it's a loved one, a family member, a friend, is going through something difficult, you always say, what can I do to help? Well, this is about to affect all of us. And so what you can do to help is you can stay home more. That's all it is. And 2 weeks of doing nothing is not a big sacrifice if it's going to save 800,000 people in our country. I feel so strongly about this, guys, and I want you guys to understand why these recommendations are coming out, that it is not fear-mongering anymore, and that it's a threat to each and every single one of us and our parents and our grandparents and our mom friends who are pregnant with unborn babies. It's time to start taking some action now so that we don't follow suit in the path that Italy and China are going through. And a lot of you have asked, well, what if I start to feel sick? Should I go to the emergency room? Should I go to my doctor's office? And quite honestly, right now, in my opinion, the answer is no. Because while there is one experimental antiviral medication that might treat this illness, you will not have access to it through your doctor's office or the emergency room. The only time that it will be administered is if you get to the point where you are so sick that you are in the ICU, you are on a ventilator, and compassionate care use from that company who created the medication has been allocated to you. So in the meantime, it's important that if you feel sick, to stay home. You may or may not have this particular virus, but you obviously have some virus, and we need to limit spread of all of our viruses right now. Because if we overwhelm our emergency rooms, they are not going to have the capacity to take care of the patients that need it, the ones that we care about, our parents, our grandparents, the ones that I keep talking to you about, because they're going to be so impacted with people who have a few cold-like symptoms. So as scary as it is, if you just don't feel well, you've got a mild runny nose, a mild cough, a low-grade fever, a little bit achy, stay home right now. Don't demand testing. And if you're starting to get worse and all of a sudden you're not breathing the way you should be, that's the time that we need to be able to see you. And hopefully we will have the resources to see you and take care of you. Having a mild illness will not be affected. So these are my pleas and my requests to you guys. I hope you appreciate some of the information that I am sharing with you guys. I have almost an overwhelming amount of information on my feed because there are so many doctors and epidemiologists and scientists that I have become friends with over the years. But I know that a lot of you don't necessarily have access to all of those types of people. And so I hope that from a medical standpoint and as your friend, this information is useful. And I will try to continue to spread more information like this as I have access to it. Take care, you guys.